The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
Foodborne illnesses. Every year, millions of Americans get sick from improper handling of food. Simple storage techniques can be the best prevention. When we close off our homes from the outside, we trap many pollutants inside.
I had a continual dust problem, and with that, I found that I was constantly sneezing, coughing.
Can adding an air purifier help improve the indoor air? Medication misuse. It's a growing problem that threatens our health and costs our economy billions. What's being done to better educate the consumer and healthcare provider? All these topics are next on Today's Health. This show is brought to you in part by Bemis Manufacturing Company, the National Council on Patient Information and Education, and GLAD.
Hi, I'm Faith Daniels, and this is Today's Health. The foods we eat are essential to a healthy lifestyle. Proper preparation and storage can preserve the nutritional value and prevent contamination.
The best way to protect yourself and your family from foodborne illnesses is to learn the simple but essential ways to handle food properly.
Most American families suffer food poisoning to some extent. In many cases, they don't even realize it. They just don't feel good, or they have a mild case of diarrhea. People who don't keep clean kitchens are more likely to get foodborne illnesses because the bacteria grow in that mess that you leave in your kitchen. The bacteria have the ability to grow on just about anything that you would consider food.
Minimizing food contamination at home is as easy as washing your hands before and after handling any fresh foods. Washing cutting boards, utensils, and other cooking items in hot, soapy water can help reduce bacteria. Also, washing fruits and vegetables thoroughly can greatly reduce the number of surface bacteria. Even soaking in a weak bleach solution can help remove unwanted toxins.
Probably the biggest problem in the kitchen is cross-contamination. The bacteria come in on something like a chicken, and then they get transferred either from the cutting board or the hands or just the fluids onto salads or onto vegetables. Keeping your refrigerator properly adjusted is also very important for food storage. It should be at about 40 degrees Fahrenheit, and you can check that with a thermometer.
There are many types of food containers on the market today, but the easiest and safest way to store food is to use a plastic product that gives you a variety of sizes and uses. The makers of Glad Wrap and Bags offer a wide variety of storage options to the health-conscious consumer. First, meats are extremely sensitive to bacteria and should be sealed in an airtight plastic bag and refrigerated immediately.
What you want to do is make sure that the meat is in the bag and that as much of the air as possible is pressed out of the meat, out of the bag, so that airborne contaminants can't get to the meat.
Second, if you're going to freeze meats for future use, use a sturdy freezer bag. Always date your food items and try to use the oldest foods first. Frozen raw ground meats should be stored no longer than 3 to 4 months, and cooked meats 2 to 3 months.
If you do bring home food from takeout, you might want to take the food and put it into an airtight container, or put the entire container with the food in it inside of a plastic bag and seal it.
If you think the food in the refrigerator isn't good, throw it out. Sometimes tasting it is all it takes to make you sick.
Enjoying food can be relatively risk-free. By following some simple safety steps, we can ensure that all our food is healthy and safe for our family.
Often we can't see them, but they can easily affect our health. Indoor air pollutants, dust, pollen, mold, just to name a few. Up next, we'll show you how simply adding an air purifier can help clear the indoor air and improve the quality of life. Stay tuned.
Indoor air quality has an effect on the lives of millions of Americans. In our homes, breathing can often become a problem, but you don't have to suffer. Air quality can be improved.
Measures have been taken to limit the outside air pollution created by our industrial society. However, the air may also be polluted inside. When we close off our homes to the outside, we keep air pollution from getting in, but we also keep airborne particles from getting out.
Air quality indoors can be much worse than it is outdoors due to the energy efficiency of many of the structures we are in every day. The average American is indoors 90% of his life in schools, offices, and homes. Today, the pollutants that manage to find their way into the home have no escape route.
I severely had a problem. I went from doctor to doctor. I literally went to 17 doctors. They all blamed it on stress. It was this, it was that. One doctor would treat the headache, the other one would treat the nose. It was ridiculous.
I had a continual sneezing, runny nose, headaches, things of that sort, wondering what was going on with me. So I did go see an allergist, wanting to clear up like the sinusitis and constantly having the runny nose and the Kleenex and everything. He did indicate to me that there was probably severe dust and mold allergies and that I needed to clean up my home.
There are three different types of problems with indoor air. One is allergens, such as dust mite, molds, animal dander. Secondly, bacteria such as viruses can be in the air, and mold spores. Thirdly are toxins such as chemicals that are emitted from new building materials, carpets.
I thought I was in contact with people, they were giving me things, it was hereditary. I thought all different things rather than indoor air pollution. Honestly, I did not give it a thought.
It may be hard to believe that the air quality in our home can be detrimental to our health, but it's true. Fortunately, there is something that can help. Adding a high-performance Bemis air purifier to a home can quickly and effectively help get rid of microscopic pollutants. It's important to choose a purifier with a high clean air delivery rate.
The clean air delivery rate is a method of measuring one air cleaner against another in terms of the amount of clean air it is processing in a given amount of time and in a given space. So the machine is rated as to its effectiveness in removing smoke, its effectiveness in removing pollen, and then a number against dust.
The most advanced and effective Bemis air purifiers contain a true HEPA filter, which can eliminate almost 100% of airborne particulate matter. They're primarily found in clean rooms.
This purifier was different. I could tell that it had a pulling system that was much different than most purifiers. It was pulling in and delivering out, which was really a factor for me. I noticed that it had more of, it had a stronger motor system where it has 3 speeds on it. It was really beneficial in the fact that you could make it as low or as high as you want.
To me, when you sleep at night, that is when you, if it is indoor air pollution, that's when you're breathing in it all the time, because that's when you're resting and you're down most of the time. So you need, in my opinion, it helped me more to have a purifier in my bedroom.
Allergy sufferers, like everyone else, spend 90% of their time indoors, and 7 to 8 hours a day of that time are spent in the bedroom sleeping. So if an allergy sufferer can do one thing during the 7 or 8 hours that he's sleeping, provide himself with a clean environment.
Adding an air purifier will decrease the number of particulates in the air and also the number of gases that are polluting the air in these small rooms.
What I'd like you to do now, Kathy, is just take a nice deep breath in and out.
Where there is not adequate ventilation, it'll also help move the air better so that there's more fresh air movement.
Now with my purifiers, with the, with a clean home, with putting tile down, with straightening up my products and limiting what I do and where I go, I live fine. And you don't have to live in a bubble. You just have to know what you can handle and keep your environment clean.
If we breathe in irritants, we don't function as well, mentally and physically. If we are breathing clean air, fresh air, if we are in well-ventilated environments where it is health promoting, then we will function at our optimal levels and at our peaks.
For many people, air quality is crucial, and removing the irritants can help you sleep better, wake up feeling better, and it can radically improve the quality of life.
I have to make sure I can read the label to tell exactly which milligram I have.
For millions of Americans, medication misuse is becoming widespread, often resulting in additional health problems. Collaborative efforts among doctors, pharmacists, and patients are helping improve medicine use. We'll show you how next.
Medications are curing more illnesses than ever before. However, it's becoming more evident that half of the medications prescribed by doctors are not being taken properly.
This may look like your pharmacy, and you may take comfort in knowing there are so many different prescription and non-prescription medications available to help you if needed. But there is a persistent problem that many people aren't aware of that threatens the health and well-being of millions of Americans: medication misuse.
Prescription medications have made the lives of patients so much better. We can treat and avoid so many different diseases that it's quite incredible in this day and age. About 50% of patients do not take their medications properly. This causes a number of problems. In fact, we refer to this medication misuse as America's other drug problem. We avoid medication misuse by placing responsibility on the patient, the physician, and the pharmacist. The patient should ask the questions. The physician should be available to explain to the patient why they're taking the drugs and what possible side effects they may get. And the pharmacist should be there to help answer even more questions that the patients may have.
We live in a time when more and more powerful medicines are available than ever before. 2 out of 3 doctor's visits result in the patient receiving a prescription. But too often, medicines designed to help aren't used correctly.
Many times patients don't take the medication the way they should. For example, with antibiotics, they should take it for 7 to 14 days. They feel better after 3-4 days. They stop taking it. The infection can come back a lot worse. Some of the other ways medications are being misused, the patient gets a prescription, for instance, for an antibiotic, and it's supposed to be taken twice a day. They end up taking it 3 or 4 times a day, believing that they're going to get better faster. It's not true. Sometimes the patient takes medication and he gets a side effect. This is manageable if the patient calls the doctor or the pharmacist and they explain to him how to take it correctly. The most common reason patients don't take the medication as prescribed is either they don't understand the directions, they believe they can take more of the medicine than they should, or they just are confused by it. When a patient goes to different doctors for different ailments or different pharmacies, it causes a problem because the pharmacies sometimes don't know that the patient has other medications at another store and he can't prevent any incompatibilities. Also, they go to different doctors. The doctors don't know about other medications that they're taking, so they can prescribe one medication and it affects the other one or vice versa. For instance, they take aspirin at one place and then Coumadin at another place, it could cause their blood to thin even faster. They could have all kinds of side effects from similar medications by building up an intolerance to it, and it can cause major problems.
It can be a challenge to organize and stay on schedule when taking several medicines. Physicians and pharmacists are available to help patients organize their medicine schedules and stay on track in terms of their treatment. Such teamwork can make a difference in feeling better and getting well.
If you're on the internet already or thinking about it, you'll be amazed at how much information there is concerning your health and well-being. For a good start, visit our Today's Health website at vstar.com. Often there's a communication breakdown between the patient, the physician, and the pharmacist, resulting in improper use of medications. Opening the lines of communication can help patients make conscientious decisions to ensure medication compliance.
Medication misuse, sometimes called medication noncompliance, affects every patient age group, including children and teens, working-age adults, and senior citizens as well. It also affects those taking medications for short-term illnesses, long-term chronic conditions, and even life-threatening diseases.
Patients with chronic serious illnesses sometimes have problems taking their medications as directed, such as patients who are HIV infected. They may need to take multiple drugs at different schedules. Sometimes patients cannot take their medication because they cannot open the bottle, or we have printed on the label when they should take their medication, but they may not be able to read it because they cannot read the small print. So we as healthcare providers need to make sure they can open the bottle or that they have the instructions in large print.
One of the most difficult things for me is taking my medication called Coumadin. It's a blood thinner, and I change my dosage quite often. Sometimes I'm taking 2.5 milligrams, sometimes 4 milligrams, and I have to make sure I can read the label to tell exactly which milligram I have.
Some older patients rely on others, like family members, a visiting nurse, a friend or neighbor to help them with their medications. Children also are reliant on parents, a caregiver, or sometimes a school nurse for proper guidance. Trying to deal with the hectic lifestyle of a family household, parents can forget or confuse their children's medication regimen. The child may be too young to take any responsibility and to tell the parent when they are experiencing side effects.
Compliance is a real problem in many patients, and we believe that one of the most important aspects in getting them to achieve compliance is involving them in their own care. When you want patients to comply, it is really important to communicate with them about the problems that can occur with any medicine. And any medicine has both good positive effects and bad effects. The patients need to know what the bad effects are right from the get-go if you're going to expect them to put up with those bad effects in order to achieve the good effects. In terms of achieving compliance, another very important aspect is the pharmacist and his role with the patient. One of the things that we work with pharmacists very closely on is for them to go over again the side effects, the difficulties with the medicine, exactly how the medicine should be taken.
The challenge to the patient who has to take a number of different prescriptions each day is to have the discipline to take the medications at the proper intervals and the proper times without skipping dosages. Two of the remedies you can use for not taking your medications on time is to get a prescription container that denotes the time of day and days of the week and place your medications in that. You can also get a calendar or a scheduler, which you can check off every time you take a dose of your medication.
The pharmacist and physician are both essential ingredients to the communication and education process that helps make complying with medications easier. Healthcare professionals have to be more aware of this responsibility and help close the information gap between themselves and the patient.
Taking an active role in your health care is essential for maintaining good health. Knowing the right questions to ask about your medication is very important to avoid adverse reactions to your treatment.
Not using medications appropriately is a persistent but solvable public health problem. Improving proper medicine use requires both a commitment to action and collaboration among healthcare providers, patients, caregivers, and the pharmaceutical industry.
In 1982, the National Council on Patient Information and Education, NCPI, was organized to stimulate and improve communication of information on the appropriate use of medicines to consumers and their healthcare professionals. The purpose of NCPI is to make sure that consumers, when they receive a prescription medicine, also get the information they need to use that medicine safely and effectively. It's important that physicians and pharmacists encourage their patients to be open and honest about their medicine use and about any problems that they're experiencing with their medicines. They should encourage patients to write down questions that they might have and to share lists of the medicines that they're currently taking. NCPI encourages consumers to ask specific questions when they receive a new prescription. What is the name of the medicine and what is it supposed to do? How and when do I take it and for how long? Are there any side effects and what do I do if they occur? What foods, drinks, medicines, or other activities should I avoid while taking this medicine? Will this medicine work safely with the other medicines I'm currently taking? And lastly, is there any information in writing about this medicine for me to refer to at home?
Right now I'm on 4 antivirals, 2 protease inhibitors, and 2 drugs belonging to the AZT class of drugs. I also take a number of other supplements, prophylactic drugs, and a whole slew of vitamins. In my case, I'm more frequently in contact with my doctor before I take a medicine and after. If I do have a side effect, I'll often, call the pharmacist and say, hey, should I be experiencing tingling when I'm taking this drug? They'll look into a book or, some computer database, and they'll get back to me and say, yes, this is normal, or no, it isn't. Go talk to your doctor. I think that in the past year or two, I've been forced to be far more compliant. This new class of drugs, protease inhibitors, they're ruthless. You have to try to be compliant or they don't work.
In 1992, NCPI organized the National Medicine Checkup Program. The purpose of this initiative is to create an opportunity for consumers to bring all their medicines in to their healthcare professional for an annual or regular review. During the medicine checkup, the physician or pharmacist reviews the entire medicine regimen to look for outdatedness of medicines, duplication of medicines, and also it creates an opportunity for the patient and provider to talk about any problems or concerns that the patient may be having with their medicine regimen.
Being an educated consumer when it comes to medications enables patients to have more control over their health, help them avoid potential problems, and by working closely with their healthcare professionals, better ensure the medicine works safely and effectively. The result is better healthcare for the patient and the ability to enjoy their health to the fullest.
If you want more information about any of the topics discussed today, visit our website at vstar.com. I'm Faith Daniels. Thanks for joining us. We'll see you next time as we get right to the heart of matters concerning your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.